Cyclic methodology applied in the facility, that is through the sorting, the setting in order, shine, standardize, and sustain. This has led to continuous improvement in provision of care at the facility. So at the Ganjoni dispensary, we chose to adapt to QI, specifically the 5S system, because it reduces waste and optimizes productivity through maintaining an orderly workplace and using visual cues to achieve more consistent operational results. So with that, we have 5S methodology, whereby it is a system that it aims to promote, sustain high level of productivity and safety throughout the workplace. With the 5S in place, we have step methodology that when we follow, it creates more clean, productive, organized workspace. So basically, it serves as a foundation and a base for deploying more advanced lean production tools and processes at the facility. So below, we have a before and after 5S pictures from the facility, and we'll later on learn about its major impacts that is 5S at Ganjoni facility. The first picture we see, this used to be our pharmacy store. The before picture, whereby there are stack of boxes without standing there. There is no any sorting, all setting, no labeling, no any of the 5S tools used. This used to cost us a lot in terms of money. That is, most of the commodity used to get damaged due to high temperatures, due to how they were handled or kept. Also, the ventilation was very poor. At the same time, it was very hard to move around the store, maybe to reach out and get any commodity or drugs and serve our patients on time. So after we did the changes, that is installation of the AC, also we did labeling of the shelves, installation of the shelves. And as you can see the after picture, it is very easy even to access the pharmacy store and get whatever you need on time. Plus the bin cards in place, made sure that our stock taking was also in order, making the data quality to be more improved. The next is the dispensing area. Before, we used to have a cupboard. Basically, in this cupboard, we couldn't arrange most of the things. And as you can see way below, we have the documents. Some of the facility documents used to be stacked here, which were unsafe. And it was a bit difficult when we want to do maybe data entry. It was hard to get some of the files or maybe some of the registers. So with that, we did the after by installing shelves and kept everything organized on its place. With the cupboard at the side, which is gray in color, whereby we put our registers and store any necessary inventory needed in the facility. Then we have the Ganjoni dispensary entrance. Like I explained before, our 5S is applied all the way from the entrance, towards the facility. The before picture, as we can see, our entrance used to have some clutter, especially on the outside, making it very difficult even for patients who are disabled or maybe come or maybe need help or carried by somebody. It was too hard for them to get into the facility due to the clutter. On top of that, at the side on my left,
maybe Hadija, you can pinpoint to the audience on what you are saying.
Yes, Dr.
Maybe you can pinpoint on what you are saying for the audience to follow.
Oh, yes. Oh, sorry about that. Let me pinpoint on that. Charika, can I continue?
Yes, continue, please. Yes.
Yeah, because I'm having some challenges on my side. So sorry about that. I will be giving direction as I try my best to get the pointer. The after, as you can see, the clutter on my right, which was cream in color, it's taken care of. And the meter box on the left, we had to change and fix and cover some expenditure in maintenance and sustain it to avoid fire hazards, which always took place. And the labeling of the signage on top of the door was done all over the facility due to the fire breakout. At the same time, the staff were trained how to handle fire in the facility. So that was a very big plus on us, covering the sixth 5S, which is safety. To continue with that, we go to our next slide. The signage, Ganjoni dispensary, the wall was blank before. After that, we had to put signage so that we most of the clients can know where exactly the dispensary is. For those who know Ganjoni, it is not easy to understand where the entrance of the dispensary is, or maybe where you should go when you enter in the compound due to different activities which go in there. So with this signage, it had improved the services a lot by making the clients understand the difference, especially between the Ganjoni Hospital and Ganjoni Dispensary and the services that we offer, which made us have an increased workload. At the same time, on our MCH breastfeeding room, on my right, that's the breastfeeding room, whereby we welcome all mothers, not only who come at the MCH, but every mother who is nearby Ganjoni dispensary. Yes, please. Hello? I can. So the mothers who come to the facility are welcome to use the breastfeeding room, which encourage the mothers to come and seek services and any other service at the MCH. And through sorting and setting, especially to take care, maybe given their immunization, this has a great point whereby now mothers feel comfortable to bring put our waste or maybe waste, as we can see there. Afterwards, we had a place whereby it was built, we could segregate our waste and put any product which is used for cleaning or maybe maintain the infection prevention in the facility or cleanliness in the facility, hence sustaining and make sure that we have the shine image at Ganjoni. At the same time, we had a contracted person come and pick our wastage, and with that, it made us to have an easy time to keep the facility clean and sustain our 5 S's. So with this transformation, there is a lot of improvement in stock taking and timely monthly reporting. There's also improvement in record keeping in all the all important records kept under lock and key, ensuring all commodities are under one roof, enhancing commodity management as we saw in the store. Then the patient turnaround time has improved from 2 hours to 1 hour per patient. The client around Ganjoni dispensary can access services with ease due to proper signage. The handing over and continuity of services between the staff has become easy due to orderliness and proper organization. In the reduction of expenditure from the month of February 2022 to the month of February 2023, we had 3,034,431 Kenyan shillings that we had to use due to expired maybe products which were damaged, and also at the same time maintenance of plants and machinery before the installation of the AC, which we saw at the pharmacy store. Then taking the same amount of money spent after the installation, especially of the AC. This is not the overall expenditure of the facility, but mainly on the medical drugs and maintenance of the plants and machinery. So from March 2023, that's when we had fully installed the ACs and made the pharmacies and the pharmacy store. To December 2023, we see a reduction of expenditure, whereby by then we have 207,354 shillings spent, which is a big plus for us, being a facility which we have to use the user fee to cater for the expenses at the facility. So other impacts is a rise in facility workload, especially patients under 5 years of age, as we saw up there, the improvement in MCH and the breastfeeding area, and the youth center and the maternal child health in general. The IPC in the facility also showed much improvement, leading to less occupational accidents due to things. Various SOPCs came into place after the 5S, like doing the quarterly 5S audit, which had been mentioned by Dr. Karima, and the quarterly internal supervision, which we do in the facility. Then there is monthly data compilation rota, which has made it very easy for anybody to compile data because of the orderliness and sustaining the way of work in the facility. And the quarterly IPC audit at the facility also, which is done to see which steps we need to improve or which steps we need to sustain. At the same time, the increase of workload from June 2022 to February 2020, 11,592. And there was a change due to our 5S and the quarterly audits. March 2023, December 2023, it was 13,369, something which the team is happy about. So basically in 5S, we should have a positive attitude, and it becomes the route whereby we can achieve total quality management, reduce our waste, and at the same time, the quality of service and management. With that said, in Ganjoni dispensary, we never rest with 5S, and for this, we keep sustaining it. Thank you very much. I welcome any questions. Asanteni sana.
Thank you, Adija, for the wonderful job that Ganjoni and the team is doing. I'm not seeing any question in the chat. Maybe anyone with a question? Anyone with a question, please? I'm just seeing very nice work with 5S at Ganjoni. Keep it up. Great presentation. Well done, Team Ganjoni. Anyone with a question before I invite Dr. Karima to showcase the Kaizen corner? Questions? Kindly remember to drop your name, CADA, registration number, and email, so that whenever we get the codes for the CPD point, we can share with you. Dr. Karima, over to you.
All right, so I have it ready.
Okay.
Just I hope everyone can see this. Is this visible?
Yes, yes.
Okay, so this is the 5S corner. I just wanted to make it as visual as possible rather than explaining. It is very similar to even the XY axis board that we did. It is used for displaying progress of 5S activities. You can have posters, any other relevant information for sharing. So it's kind of a way for the way we have even our Kaizen boards, like you can meet as a team, everyone can see